Hey everybody. I'm just making a video for family and friends to just give you an update on what's going on with me and my little health journey that I have going on. So I have the BRCA1 gene mutation, which means I have a really high chance of getting breast cancer and ovarian cancer. And also some other risks for getting melanoma, pancreatic cancer, some other things, but mainly the higher risks are the breast cancer and the ovarian cancer. I had a total hysterectomy in May, and I had a genetic testing done and met with a genetic counselor who informed me that I could do MRIs every 6 months and a mammogram every 6 months, MRI every 6 months, mammogram every 6 months to try to catch breast cancer early if I want to do that route. And then it dawned on me that I could get the insurance to pay for mastectomy, a double mastectomy and breast reconstruction. And which had never dawned on me before I had that conversation with my genetic counselor, because I wanted to make sure that my ovaries and everything was taken care of. I was so focused on that because of the CA125 and going up and all that stuff. So now that that's out of the way, I'm focusing now on my breasts to try to prevent breast cancer. So I met with a surgeon. Her name is Teresa Reading. I met with her, and she's going to do my double mastectomy. And then she said if I want to do like reconstruction, that I need to find like a plastic surgeon who will do that. And I did decide what kind of reconstruction I wanted because I was doing some research. I decided on the DIEP Flap surgery instead of implants. So you can look up that surgery, but basically they take the nerve, the blood vessel from the lower abdomen. It's basically a tummy tuck. They take that tissue and they reconstruct your breast from that tissue. They reconnect the blood vessels and the nerves to try to give you a little bit more feeling. I have another video that goes into more detail about all of this, and it goes way back to like June of last year to when all of this started happening, if you want to watch that. But today's video is mainly to talk about the plastic surgery surgeon that I met last week and the one that I met today. So the one I met last week, Charles and I, we went there and we just didn't feel like he was very personable. He just didn't feel like he had we couldn't connect with him. He didn't have a very good personality, he just was matter of fact. And I mean, I felt like he could do the job, but he also told me I couldn't spare my nipples. He said that there was just no way. So I was going to have to just get 3D nipple tattooed on if I went with him. And also it was going to take a whole year. So he said that his time frame was that he likes to do the tissue expanders. So a tissue expander is basically a silicone implant that has a port that they can put a needle through and fill up the implant with saline fluid to create a nice little pocket for the tissue or the breast implant to sit in. And that little pocket would be created from scar tissue, created from the tissue expander being in the breast area. And so he said that he would the surgeon would do the double mastectomy, and then he would be there at the same time and put in the tissue expander. And then he said that my recovery time would be he wanted me to take 8 weeks off work because I would have to go in every week to get the tissue expanders filled. They put a needle through your skin into the port and fill it with saline. So every week you had to fill it, and then the next week you come in and you fill it, and you keep filling it till it's about the size that you want for your breasts. And then they come back in and they either put an implant into that little pocket, which is nice because then when you let's say you had an implant and you had a nice little pocket, when you lay down, the implant doesn't fall down to the sides of you, or it doesn't like wiggle around, and it doesn't have it's just a nice little pocket that helps keep it secure. And same thing with the DIEP tissue. So the tissue from the belly, it has a nice little pocket to stay into, and it just looks a little more aesthetically pleasing than without that tissue expander, but it's not necessary to have the pocket from the tissue expander. And so he said that he would get the tissue expander put in at the same time as the surgery, and then, take 8 weeks, and then 6 to 12 months later, then he would do the DIEP surgery. And I asked him why so long. He just basically said that cancer patients are priority, and that's just how long he's out with his backlog of patients. So I had decided before I met with that doctor, I had done a little bit of research on him, and I had just decided, I don't feel right about this doctor. I don't feel peace about him. So I had called a doctor that I had previously wanted to get in touch with. Before I was even scheduled with him, I wanted this other doctor that I knew was really popular in the Salt Lake area. And he was not taking new patients. And so basically, after I did research on this other physician, I decided to call that office again just to check and see if maybe he was taking new patients again. And they said that he wasn't, but they said they had a new surgeon who had just came on board with Intermountain a month prior at the time that I had called. And that they could get me scheduled with him, and that he has had experience in Arizona doing breast surgeries. That was his main focus. So they said they could get me in like in a week. And so I thought that was great. So I just had that appointment today. So Charles and I went to this morning, and we met with Dr. Spencer Michalke at Intermountain Medical Center Hospital. And it was amazing. So it was much different from the other one last week. And also the setting was different. And so you went in, it was a normal, like at first blush, it was just a normal doctor office. There was like 2 little chairs and the patient table with the tissue paper on it or whatever. And the nurse came in, she asked me a bunch of questions, and then she said that the doctor would be coming into this a little other area. So there was like a sliding door, and it opened up into a little private room with 2 big comfy chairs that Charles and I sat in, a little end table with like some snacks and some water. Like there was a big screen TV on the TV, and there was another chair, another office chair directly across. And it was just a nice, cozy little setting. And Dr. Michalke came in, and he sat down, and he immediately was so friendly, and he immediately went into his name and where he was from and how long he had been in Intermountain. And he was so friendly, and really we were able to connect with him and laugh with him, and just it was so different from that other doctor. And I immediately was like, this is him. And I had watched a video on this guy before on Intermountain's website, and so I kind of knew a little bit about him already. And he told me that he told me that he does nipple sparing, and I told him that the other surgeon said that I wouldn't be able to spare my nipples, and he asked why, and I was like, I don't really know. He didn't really say why, and he said that he has experience in being able to save nipples if that's the case. There's only been like one time when like he wasn't able to save a nipple if that's what the patient chose, so was to save the nipples. And so he said it depended on my anatomy though. So this was before like I got undressed, and he like examined my body and everything. And he told me that like I even talked with one of his patients, you guys, because there's like these Facebook groups for basically anything, and I found a couple for the DIEP surgeries, and I typed in Dr. Michalke's name in the search field in the Facebook group, and there was some patients that came up, specifically this one patient who had the DIEP surgery done by this doctor in Arizona. And so I private messaged her, and she and I had been talking, and she sent me pictures and everything, and I asked her questions, and she said she really liked him. And so I told him that I had done all of that, and he asked her what her name was, and I told him, and he remembered her and stuff like that. I was like, I'm sorry, I didn't mean to stalk you, but I kind of just, have been doing research. It's just what I've been doing. And so he thought that was funny and good that I'm doing research. And so basically we found out after the examination and everything, he said that they have a new surgeon that started this week. And so that surgeon will be able to help him, and they can ultimately do my surgery, my DIEP surgery, at the same time as my mastectomy. So I don't have to wait. He doesn't think I'll have to wait at any time or have two surgeries. And he prefers it that way because he wants to have two major surgeries. So he thinks it's better for the patient overall to get the surgeries done all at one time. Whereas like other surgeons think it's better to like heal, like have the mastectomy and then heal and then do the reconstruction. But he doesn't think that he's like, why put the patient through that? Just get it all done at one time, you know? He said that he would be able to spare my nipples. So that's a whole nother thing. My other video goes into more about that. But so he said that he'll know for sure, like during the surgery, if he's going to be able to spare them. And I said, well, if you can't, you can't, you know. I'll just get the 3D nipple tattoo. And if you can, then let's go for that. So that's what we're going to do. And he said it could take about 4 weeks to heal. And the other doctor said it would take like 8 weeks. So I'm thinking of taking a leave of absence for like 6 to 8 weeks. And I'll take like short-term disability so I get a little bit of pay during that time. And so since he's new, he's only been at Intermountain for like 2 months. He doesn't have like the backlog of patients that are waiting. And he doesn't have, so they said that basically within like 4 to 5 weeks, I should be able to have this surgery, this major surgery. They just have to have like 2 weeks or so, 2 to 3 weeks to get the insurance to get approved the prior auth. And then like maybe another week to like get with the other surgeon and coordinate dates for the doctors to all get together at the same time to have the surgery. And they said that I should be getting a phone call in like 3 to 4 weeks telling me when my surgery will be, which would be like in a week. So, you know, 4 to 5 weeks is what it's looking like it's going to be, which is good because we wanted to get it done this year. It's a good time of year to get it done. And then I have like, basically, you know, it's good to get it done like in the fall or winter. And then I have like that time to heal before summertime when maybe I want to go swimming or something, you know? And so I'm really excited because this is what I wanted. I didn't want to wait a year. Who wants to wait a year?